Now, as all of you know, the outbreak of the COVID-19 is having a profound impact on our region's community, its businesses, and its governments. And during these challenging times, it will take a unified approach to maintain business sustainability as our region embarks on the road to recovery. The St. Louis Regional Chamber remains committed to serving as a convener and an advocate for our members, our investors, and the community partners during these challenging times. Good morning, I'm Tom Chulik, President and CEO of the St. Louis Regional Chamber, and today I'm very excited to have 5 regional leaders that will discuss the respective government's response to COVID-19. St. Louis Mayor Lyda Krewson, St. Louis County Executive Sam Page, St. Charles County Executive Steve Ehlmann, St. Clair County Chairman Mark Kern, and Madison County Chairman Kurt Prenzler remain committed to coordinating a regional response to this pandemic. I would like to thank them all for their leadership, their support of our region, and for taking time to join our virtual meeting this morning. And during this very challenging time, it's been terrific to have all these leaders on regular conference calls and working now collectively and collaboratively for the benefit of all of us in our region. To all of you, I say thank you very much. And now I'll turn it over to Austin Walker, VP Public Policy of the St. Louis Regional Chamber, to start off today's program. Austin?
Thank you, Tom, and good morning. I would now like to pass the baton to Mayor Lyda Krewson for her update on the City of St. Louis's response. Welcome, Mayor Krewson.
Thank you, Austin. Appreciate the chance to talk with everyone here. I'll try to be quick with this, but of course, you know we've issued a stay-at-home order. We understand that that is devastating for business and devastating for our employees. We have been focusing intently on working with our federal lobbyists and our federal legislators to try to have as much mitigation in the bills as possible. Some of that came out on Friday, and we think that that will help a number of businesses, but certainly not all businesses, in the recovery phase of this. Quite honestly, right now, we are in the response phase, as I see it, and we have made efforts to keep as many businesses as possible open while still protecting both their workers and the general public. I'll just stop there and say, hopefully most of you know that construction projects, most of the major construction projects are still going. We are still working on pre-development activities for construction projects and evaluating the pending, or what's now passed, federal legislation to try to be able to provide as much as possible for our businesses. Lastly, last point, we have formed a small business loan fund. City of St. Louis has put in, actually SLDC has put in $400,000. I believe the county's put $350 in, and this is a $5,000, very, very low amount, of course, loan fund for small businesses to try to bridge the gap until they can get to some of the federal SBA loans, et cetera.
Thank you, Mayor. And you mentioned that we're in the response phase at the moment. Do you think Missouri's response and the federal government's response has been sufficient? And if not, where do you think it could be improved?
Well, I think most of the country realizes that we need more tests, that we had a failure of the first test that came out. We've never caught up with that. I'm sure you're probably asking me more about business, but right now we are very, very focused on trying to evaluate where we are in this process. There's probably some hospital representatives on here who may be able to speak to that, but certainly we need more testing. We need more PPE here. We get most of that from the federal government. We are sourcing a lot of it ourselves, both domestically and internationally. Right this minute, we have enough PPE for our essential employees, police, fire, corrections, and for them to keep going, but we have to continue to source that. So in general, I don't want to throw stones at folks. I'm not sitting in Washington trying to make all these decisions and find all these stockpiles, but from someone who's on the ground with this, we really need a lot more federal help.
Thank you, Mayor. And can I also ask, where in the city or just the community, the region at large, are you seeing outstanding work being done, either from a business or a public agency? And maybe how could the business community contribute and follow their lead?
So many outstanding things. While, I express frustration at the things that aren't happening, if we all stop and take a breath here and have a little patience with one another, we have so many businesses that are doing such good work. Take a look at our grocery store businesses and the folks that are working there, and the leaders in the grocery industry, the healthcare industry. They're doing incredible work. And I also express a lot of gratitude to the people who live in our community. Most of them are trying to follow the stay-at-home order, and most of them understand the seriousness of this order. But I think there's a lot of really great work going on in this community, and we will get through this together. I think that's someone's tagline, and I like it. Right now, we are in the response phase, and we are very, very concerned about the number of cases we are seeing, the number of exposures that we are seeing, and planning for what may be ahead in the next few weeks.
And if you could leave our members, with maybe one or two things where you think could use more attention, what might those areas be?
I think communication. We continue to try to communicate, and I know that the business leaders are trying to do that throughout their own companies. And I think the communication that this really is a very serious issue, and I'm sure everyone on this call understands that. But the further down we can push that message, the better. And so appreciate their help in continuing to communicate with their circles, their employees. I think that's the best thing that we can do now, because the stay-at-home order is our order goes until April the 22nd. I believe that's the same date for the county. It's certainly possible, maybe I would say even likely, that will be extended. But the more compliance we can have with that, perhaps the shorter that time period will be.
Thank you. And just one last question, Mayor. Who can be a resource in your office for our members who operate large and small businesses?
St. Louis Development Corporation, Otis Williams. I don't know if Otis is on this call or not this morning, but certainly that's the place for large and small businesses, I think, and has been historically. And of course, I would maybe put that back to you. I think your organization is also a good resource.
I would have to agree with that. Thank you, Mayor, very much for joining us and your insights on the situation in St. Louis City. Now we'll hear from St. Charles County Executive Steve Ehlmann. Mr. County Executive, the floor is yours.
Yeah, thanks, Austin. I'm going to be brief and leave more time for your questions. One of the most frustrating things for us in St. Charles County has just been the level of testing. And up until very recently, we had very, I wouldn't say few, but much fewer positive cases. And at that point, we thought, well, maybe we're just doing a good job out here. But what we were afraid of was that we just weren't testing as many people as some other parts of the region were. We're having an uptick the last 3 or 4 days. I think that's mainly because before we had maybe a false sense of security because we hadn't been testing as many people as the rest of the region. I've done some research on the 1918 epidemic, and what came across there very strongly is what we're seeing today, and that is it started and was worst in the most densely populated parts of the region, but eventually spread out and affected everyone. So the effect in St. Charles County may be a little bit delayed. And of course, that makes it more and more difficult for us to impress upon people the necessity of doing the social distancing, the necessity of going out only to obtain essential services and business to essential businesses. But as we proceed here, I think the message is getting out, and it's important that your organization and other organizations join with us in continuing to educate the people on this process. Again, looking at what happened in 1918, this didn't just happen overnight, and it didn't go away overnight. And what we're looking at here in the future, hopefully soon, is when the numbers start to decreasing, we're going to be getting more and more pressure from businesses and individuals to loosen up on some of these restrictions. And back in 1918, after they did that, they had a reoccurrence, and they had the numbers go back up. So this is going to be a continuing debate. It's important that the business community be on the side of those of us who want to be safe in this situation and do everything we can while we prepare for the worst and hope and pray for the best. Got any questions, Austin?
Yeah, so this is clearly a health crisis first, but how difficult is that decision to close businesses and limit economic activity?
Well, it's very difficult. In fact, I think the regional leaders have done a good job of keeping politics out of it so far. But at some point, philosophy enters, and that's why last week when we joined with everybody else in ordering people to stay home except for employment and to obtain essential services, okay? When we did that, we didn't take the next step as others have elsewhere. We did not create a list of what businesses government thought were essential and which ones were not. We basically left that up to each individual person. I've had several businesses that since that time who were not, maybe not planning to close. They were glad we didn't order them closed, but in the next several days, they got the message from their customers that what they were doing wasn't essential. They've since closed down, and I think it's important, to me anyway, that they made that decision on themselves instead of having government make it for them. So that's where we are now.
Sure. Do you think the response that we've had here in Missouri and the federal response has been up to par? Do you think it could be improved?
Well, I'll let everybody has their own opinion on that. I will tell you one of our problems with the lack of a statewide response is that we keep traffic counts on our various roads to see who's out, how much people are out, and it has declined significantly in St. Charles County over the last 2 or 3 weeks, but not as much in the western part of the county as in the eastern part of the county. And a lot of that is because a lot of people in the western part of our county are from Warren and Lincoln County, and basically they either have not been educated, at least they've not been restricted as to what they can and can't do. So, in the eastern part of the county, we're adjacent to St. Louis County, and 60% of the people in St. Charles County work in St. Louis County. So they are getting the message much better than the people in the western part of the county, and that's just one of the problems with that, without having some kind of statewide response to this. So in that regard, I'd love to see the state get a little more involved.
Sure. So, Mr. County Executive, have you thought about plans yet to utilize your portion of the $150 billion of funding that'll come back to the states and local communities through the federal government?
Well, we have not been waiting for the federal government to tell us they'd send money, and we've gone into our reserves. We spent millions of dollars already. It's nice to know that at least a portion of that will get back from the federal government. But the fact of the matter is, there may be smaller counties in the state out there waiting, and they haven't done anything. My hope is that when they now have money available, they don't do something just because they have the money to do it. Those of us who have been out front on this, I hope that the people in Jefferson City will realize that we've already made significant investments. And we have been out front on this. And I hope that when the various awards are made to different jurisdictions, that will be taken into consideration by the folks in Jefferson City.
Sure. Now, Mayor Krewson mentioned a couple of bright spots, during all of this. Where in your community are you seeing outstanding work being done, either from a business or a public agency?
I mean, where do you start? In county government, very proud of the work that our health department has done. We've got some epidemiologists who've been doing a tremendous job. I don't know if people understand this, but when we get a positive, we go ahead and interview those folks and find out where they've been, who they've had contact with. We've had folks working around the clock on that. Our law enforcement people have been vigilant. We're all very concerned to make sure they have all the necessary equipment that they need, because they're the ones who are going to be on the front line. And up until this time, everything has been designed to minimize the chances of someone becoming infected, and that's a very important step to take. But the next big step is to make sure that those who have been infected, to make sure that they quarantine. Up to this point, I think we have 170 people that are on a mandatory quarantine. I'm pleased to report that 100% of them have cooperated. But we all know human nature being what it is, if that number gets larger and larger and larger, we're going to have more and more people who simply choose not to abide by that quarantine. And now, when they leave the house, it's not just a problem for them; it's a problem for everybody else because they can infect others. And that's why I think it's so important not to overreact, but to bring the public along and make sure that they are with us on these things. Because at some point, if people decide not to cooperate, we're not going to have enough law enforcement people to make them do that. We don't know how many law enforcement people we're going to have show up at work next week. So that's why the educational part and the public relations part is much more important than the orders that we issue. So that's what it is.
So there
Anything
really
else,
are,
Austin?
Yeah, there really are a number of just challenges there, and there are priorities as well. What do you think right now in your community needs the most attention?
I think we need to make sure we're getting everybody tested that needs to be tested. I think we need to make sure that the people who are going to have direct contact have the equipment that they need. And I think we need to make sure that the federal money that becomes available is distributed in a fair and equitable manner, and that it's not wasted, it's spent wisely. And what'd I forget, Austin?
No, I think that you're good. I think that's fantastic as far as an update. One more thing, though. Who might be a resource in your office for our members who are business owners?
Well, I would say, Scott Drachnick at the EDC, obviously, might be the first person you want to call. But we have on our website, we have hotline numbers and everything for everyone. And if it's a general question, I would call that. If it's a question specific to business, I would call Scott. We had a conference call with several of our largest employers earlier this week, and I was very impressed with some of the things that people had been doing on their own without government telling them to in some of our bigger businesses. And if the smaller businesses want ideas, they're certainly out there, and I would suggest you contact the EDC, Scott Drachnick in St. Charles County.
Fantastic. Mr. County Executive, thank you very much for your update and your government's response on what's going on in St. Charles.
Austin,
really
thanks for everything you're doing, and just keep up the educational effort here.
Thank you, sir. Will do.
Okay.
I would
See
now
ya.
take care. I would now like to pass it on to St. Louis County Executive Dr. Sam Page. Please welcome County Executive Page.
Hi, Austin, and thanks for the opportunity to speak with your group. And I'd like to just summarize what we're doing and then take some questions. Just take a couple of minutes to walk through this. We've been focused on this really in 3 prongs. First, to save lives, then to help our residents meet their basic needs, and then to restart the economy. And we have several partners in each one of those pieces. To save lives, we first have to focus on flattening the curve. Everybody knows what that means now. Not just flatten it, but postpone the impact so we have more time to prepare. This really the pieces of flattening the curve are prevention and testing. Prevention depends on increasing community awareness with what individuals need to be doing to help themselves and to help all of us. Increase physical distancing, enforce quarantine and isolation policies, and then to customize prevention efforts for high-risk groups. And our health department's provided a lot of guidance there as well. The testing piece is difficult. We have a national shortage in testing. It's completely changed the way we have to respond to this pandemic. We don't have the same luxury as Asian countries who can aggressively test, isolate positives, and quarantine all of their contacts. We have to respond to this epidemic like communities have responded to epidemics for the past 1,000 years, and that's quarantine people in large groups. That's been very difficult. So we're working on trying to expedite the screening process, and now we're trying to identify patients who are probable COVID-19 patients because of their symptom complex and isolate them and support them in this environment where we don't have enough tests as a country, which affects us here. We're working hard to scour the globe for testing supplies. We have a team working on that, just like the hospitals have a team working on that. We will make, like all of our equipment, when we purchase it, it doesn't always come. And we get postponed or we get our orders canceled. And we're dealing with that environment just like the hospital systems are in the rest of the country. Once we have the tests, we distribute them equitably. And we're working on improving our communication strategy to make sure folks understand that that's exactly what we're doing. There's not a geographical distribution of a test. There is criteria that have to be met in order for you to get the test. It goes to first responders, healthcare workers, and people who are very sick in the hospital. People that are healthy at this point in time who have symptoms probably aren't going to get a test because we don't have enough of them. It's not my decision, that's the CDC's decision. That's how we limit the supplies, the very few supplies that we have to do the most good. And then we're working to increase data sharing with all of our community partners, our regional health systems, our hospital systems, and our elected leaders are all in constant communication. Speaking of our health systems, we're working with them as they increase their capacity, look for understanding on how they're going to expand. They may have shared that with you. They're working together really in an unprecedented sort of a way to combine resources, to combine purchasing leads, and to align their policies. We're working very aggressively to help residents with their basic needs. That means food, housing, childcare for emergency management people, and our folks who work in the grocery stores, and our doctors and nurses. Schools are out, they need childcare support, and we've stood up a significant footprint there with a lot of community partners. And then in any sort of crisis, there's an explosion of mental health needs. We're watching that very closely and working through our network of nonprofits and community leaders. Restarting the economy is important. We see what's happened at the federal level. The stimulus bill is important. I'm going to create an economic rescue team that will be specific to St. Louis County. The Economic Development Partnership is an extraordinary resource for us. We're working with them very closely as they start to refocus all of their attention moving forward on responding to this crisis. At the same time, trying to keep their current projects that are in the pipeline going. And then, of course, we'll be providing and working closely with our local business organizations like yours to collect their ideas of what our needs are and try and respond appropriately from county government. I don't know how much time I have left, but I'd be glad to answer any questions.
Thank you, sir. So you mentioned the stimulus, and we've been talking just a little bit about the federal government's response and Missouri's response, and you've been an early actor in this situation. What do you think about Missouri's response and the federal response? Do you think there could be more that we can do at this moment? Obviously, I would think the answer would be yes.
Well, I think that's a rhetorical question, and I recognize it. It is what it is. At the national level, we got behind. They're playing catch up, and it's not just, the problem is it's not just one part of the country where they can scale up and send all their resources. Every part of the country either needs this now or will need it soon, and they're, it's an unfortunate situation. It would help in Missouri if we had the standardized response. A stay-at-home order from the state would help us a great deal. But I also want to recognize that the governor's office is working with us on a lot of other fronts, trying to help us get PPE, trying to help us with testing. They're helping us with testing as much as they can, given a very limited testing environment in our country. So it certainly could have been better. It could be a little bit better going forward. Our state has helped us in a lot of pockets. A statewide social distancing order that would be consistent with the areas of highest need, which are the urban areas, so that the rural areas don't get too much of an explosion of this virus because they have a little more interaction. That would help us a great deal.
You mentioned flattening the curve, and that's what the business community is certainly talking about. And I think now that folks have an understanding of what this is all about, the public to some extent, you are in contact with a number of public health experts. Do you see that we're making meaningful progress in flattening that curve? Do you think we're making a difference?
Well, I know that we're making a difference, but there's no way to measure that difference right now because we're too early in the process and we don't have enough of a testing environment. And the markers that you would expect to see from success in your interventions won't appear until later on. It takes 2 weeks to have any impact at all, and it probably takes a couple more weeks to see a response to that impact. That's because of the incubation time of this virus and how it's spread and how it's already spread among other people before these interventions were implemented. But I do know that the things that we've done will have an effect because they always have an effect. I can't tell you how much they've had an effect until we have some data to measure them, and that data won't be available until time passes, where you would expect to see the result of your decision. And we have a more robust testing environment. We're going to see the hospitalization spike, and we hope that that will be a flatter curve than it would have been otherwise because of our interventions. We very much need to slow the spread of the virus down in our community so we can, so our hospital systems can manage the influx of patients.
If you had to list one thing that keeps you up at night, what might that be?
Well, this is a complicated issue. There's not one thing. I think that our hospital systems and our public health agencies, especially the St. Louis County Department of Health and the Emergency Operations Center there, have done really some great work. The challenge we have is this is something that we have never seen before as a country and in 100 years. And the travel that we have, the ability for people to move about the country has made this much more challenging than it was 100 years ago. So, we have to develop a system to deal with something that we've never seen before, and we don't have a good model for it. So it's just an extraordinarily complex process. I think what we need to be doing, what keeps me up is the whole thing. Really, it's just extraordinarily complicated. The challenge is our communication, but we're focused on that. I think everything that is a dependent variable has an enormous amount of attention focused on it right now. And we just have to run our plan. We know what our plan is. We need to execute the plan. And we need to do it with some quick decisions.
Well, so you're dealing with some pretty serious challenges every day, no doubt, and the region appreciates your hard work. Are you seeing any bright spots, in your work
I
over the
think
last
the bright
year?
spots are the people that stepped up to help without being asked or told. We've seen an enormous amount of spontaneous activity. Churches helping their parishioners and other people. We've seen people sewing masks on their own and delivering them. People collecting for other folks and just delivering them. Our food banks are pretty active. Our civic leaders have stepped up to identify historic nonprofit partners and new partners, ways to help in those basic needs categories, because we need to make sure we're taking care of those basic needs so people can get through this without stress. A stressed out population without basic needs is going to be very difficult to manage, and it's not going to be a very productive experience. But people stepping up spontaneously to help. It's also been very inspiring how our three health systems have come together to work together.
Thank you. And one last question. Who can be a resource in your office? We've been asking how the business community can connect. Who would you suggest?
Well, St. Louis County is the primary funding source for the St. Louis Economic Development Partnership and all of its agencies. That's where we depend on mostly. We're going to create our own economic rescue team, and anybody that's interested in participating in that should contact our office through the stlcorona.com webpage, and we'll be putting that together, and then that will have its own reporting mechanism to our office. We aren't going to step that up operationally yet until we get through this first wave of people who need medical care, but we're going to try and create that process in parallel. So once we're over the hump, we can move very quickly to try to put things back together. But the St. Louis Economic Development Partnership handles most of our questions related to small and large businesses, and we're going to create some supplements to that moving forward.
Fantastic. Well, Mr. County Executive, thank you very much for your briefing and update on the situation in St. Louis County, and for being here with us today.
Thank you.
Now we'll shift the conversation to Illinois with an update from St. Clair County Chairman Mark Kern. Mr. Chairman, the floor is yours.
So good morning. I sure appreciate the chamber coming together and bringing this together today. The best thing for business in this is really what's best for the community, and that's to get through this pandemic in as short a time period as possible. We're fortunate in Illinois that our governor is not acting in a piecemeal way. He issued a statewide shelter-in-place ban. Our shelter-in-place request and mandate 10 days ago, which we are under right now here in St. Clair County, as every county in the state is under. We have an emergency declaration that has happened in St. Clair County that we proclaimed, and our emergency operations center is open and operating 24 hours a day, 7 days a week. The governor has now supplied 2 National Guard members that have been assigned to our ELC. Along with members of the health department and every department in the county, we're working together to make sure that we can get through this pandemic as quickly as possible and as efficiently as possible. We jumped from 29 positives yesterday to 41 in St. Clair County. That is concerning to us, but we are also realizing that the fact that people are sheltering in place, staying at home, that's really what the public can do to make sure that this number grows at as slow a pace as possible, that's going to be able to help us to keep our hospitals and emergency rooms free of people, so that the really sick can be treated, so that COVID-19 victims have the best chance of recovering. That's what we're doing. We're operating a live feed briefing every day here in St. Clair County at 3:30. It's put on by Herb Simmons, our emergency operations director, as well as Brian Whitaker and Randy Randolph. And together we're putting this live feed on with the medical community. We're coming in, addressing questions that the community may have. We also have representatives from the educational community, from all walks of life. Any questions that are out there with the public are being answered on a daily basis here, 7 days a week. So I think with that briefing, I'll move into the question part. I think that that's where we're going to find out the meat of what's really happening.
Well, Mr. Chairman, thank you very much. And you mentioned that the Pritzker administration has come out with some strong action to fight the spread of the virus. Are there any other measures that you think would be helpful for your area in Illinois?
Well, we're fortunate that, and Memorial Hospital, BJC, St. Elizabeth's, Touche Hospital, our medical community has really stepped up. The nurses, the doctors, the emergency personnel have all stepped up, but they got to have the PPEs, the equipment, the testing necessary to do their job. Those type of things are extremely important. We rely on our federal government to be able to supply those to us. We're currently waiting for a shipment of PPEs here to arrive at our EOC to be able to be distributed to our emergency personnel. That's something that needs to happen that is not happening at a pace we would like to see here in the county.
Do you have any thoughts on the federal government's response? The administration has progressed, and it seems like they're getting more tests out there and getting up to speed a bit. And Congress is trying to, looks like, do the same thing with the biggest spending package that any of us have ever seen. Do you think the response by the federal government has been sufficient, on the administration side and for Congress?
So what I will say is that between the local, our state officials and our congressional caucus, as well as the senators from this region, they're all working together really well in a nonpartisan way. Something we haven't seen for a long time. Republicans, Democrats working together. They're rallying around all of the government entities during this time. So I think that's a real bright spot in what's going on. Unfortunately, it appears that the stockpiles were not sufficient on the federal level to handle this pandemic. That's a problem, and it's a problem that unfortunately we're playing catch up when we should have been there ready to get this thing going to start with. So we are working with what we have. My concern is that the medical community appears to be pretty tired. They're worn out, and they shouldn't have to worry about reusing a mask or a gown. They should be able to count on having those supplies there for them. So we're in hopes that they're on their way. I know that the governor of the state of Illinois is working diligently to try to make sure that the PPEs are available. And so, frankly, we're relying on the state of Illinois. They're the ones that have come to the table and issued these mandates that I think are going to make the biggest difference in this pandemic. Shelter in place is what every person can do to make sure that this virus goes away. Unfortunately, when you have a piecemeal effort, as is going on in some states, that's a problem. Everybody's got to work together. Every county has to be doing the same thing. So we make sure that when we ramp up to this level, and it is going to peak probably in about 2 weeks, that we're all peaking at the same time and going down at the same time. What we don't want to happen is an area that all of a sudden becomes a hotspot and reinfects the region after we get through this this virus and the pandemic that we're in.
Well, so this is all very scary stuff, I think, for regular folks, and certainly for our business owners, both large and small. No doubt you're out in your community. What are you hearing from folks, when you talk to them? People in the community, business owners, what are they feeling right now?
So, we're trying to use carryout as a family. We think that's an important, we think it's important to keep our local businesses going because we want them to be around after this is all over. We want to have our lives go back to normal, and certainly having our eating spots to be around after this is over is important. But people are generally positive. They're rallying behind this effort. They're staying home. The local police departments, the fire departments, the mayors, we've all gotten together and we're all fighting this same battle together. So in general, the public seems to be in pretty good spirits. What I would say is that, this is going to go on for at least the month of April and likely will be well into the month of May before things return to normalcy. And we have to be aware that things are going to change as people get tired of all of this and they want to get back to their normal lives, and they're going to become impatient. We're going to have to all be together and make sure that we've got strong operations to keep things together.
So we've got a major federal military installation on your side of the river. Are there any conversations going on right now involving Scott Air Force Base and any possible response or cooperation?
So we're always we're in constant contact with our friends at Scott Air Force Base. They have their own restrictions, and the base has been, and I've seen, in the local media, Scott has put out that they're limiting access to the base. They have to do that. You got 13,000 people that work at Scott every day, and military contractors that are there, and they have important things that are going on. They've got to keep those efforts moving, and so their restrictions certainly may be more onerous than what we're seeing elsewhere, but they know how to run their operation, and we're in full support of them.
Mr. Chairman, one last question. Who can be a resource in your office for folks in the business community?
So, the state has put forth grant programs to help out hotels, bars, restaurants during this time, a hospitality emergency grant program. There's small business loans. The Community Development Block Grant Program, we expect to be a big recipient. Our St. Clair County's Community Development Block Grant Program will be a recipient from the federal stimulus package. Rick Stubblefield, he's our economic development person at the St. Clair County Grants Department, and his number is 618-825-3203.
Fantastic. Chairman Kern, thank you very much. Thanks for your insights and the update on the current situation in St. Clair County. Appreciate you being here with us. To wrap up today's briefing, we'll now hear from Madison County Chairman Kurt Prenzler. Please welcome Chairman Prenzler.
Thank you. Can everyone hear me?
Sure can.
Sure. Well, we have, I think, less confirmed cases in Madison County than some of the others. We're at 16 as of yesterday, and we're just thankful that that's where things are. The mood that I sense in the county is everyone's very patient and wanting to shelter in place and keep distance and stay healthy. And we fully realize that there are other hot spots in the country that are getting a lot more attention with respect to testing and PPE. And of course, we would like more testing and we would like more PPE, but I think the mood is that we see on TV and we see in the media that there are other parts of the country that need that more than we do and are very challenged. So I think we're all hoping and praying for those communities that are really having a real tough time, and we're just kind of taking care of business here in the county.
Sure, and we've been talking a little bit about Illinois response, the federal government's response. We're wondering your thoughts on what you think the Prenzler administration can do to help further, and what you also think about the action going on with Congress passing that $2 trillion package and the administration's efforts.
Well, I really haven't been focusing that much on the federal level. I mean, I have been watching what's been going on in terms of, it looks like there's tremendous innovations and ramping up of testing and also different medications and attention. I'm not a medical person, but I've just been reading about the different things that have been from Europe and from other places, techniques and from Asia too that are helping, and I think they're starting to be implemented. I think that some of the bureaucracy is getting out of the way so that those things can take place. But I think that we're watching other parts of the country deal with this first, and I think we have the advantage of not having the severe outbreak here, so that we have time to prepare, and I see that people are doing that. One additional thing, I going forward, I would like to, what we could do to encourage people to what they could do on their own in terms of getting a little sunshine and taking care of themselves and being healthy themselves to, because from what I'm hearing anecdotally are some of the folks that are coming into the hospitals are not healthy to begin with. And this COVID-19 is just tipping them over. And so whatever we can do individually to remain healthy, I think that's something that we should begin talking about.
So how are businesses adapting in Madison County to this new reality? You see a lot of businesses that are trying to shift their hours to offer drive-up options. What are you seeing in your county?
Well, the restaurants, it's really been difficult for them, of course, hotels and some of those areas. I would say that the food stores and a lot of the businesses were actually were shifting and making changes even before maybe some of the government people thought about them. And so I think that's been positive. I think everyone's just kind of hunkered down and creating distance and hoping that this will be over soon. And I think we're learning a big lesson as a nation. And so, yeah, I think they're all kind of wanting to create the social distance and do the right thing so that we can get healthy again.
Absolutely. And we've been talking about the number of challenges, and there's just so many that you can hardly count, and everything seems to be a priority. Is there something in your community that you think needs more attention than anything at the moment?
Well, I think recently the public health departments, I think, were a little reluctant to share some information. People have wanted more information, so we've begun to provide that. And so we're providing, I've noticed, we've been kind of catching up a little bit. We had sometimes the public health people, they would rather not share information, but I think people really want to know more about what is taking place, and I think that's a good thing. So I think we're moving in that direction. And I think generally that we have 5 hospitals here in Madison County, and I think that they're all in different groups, but they're generally all waiting for. They understand that the battle is being fought at a faster pace, and in other parts of the country right now. So we're all hoping that we're all looking to New York and seeing some of the new things they're doing there, and hope that begins to work.
Sure. And one last question, Mr. Chairman. If businesses in Madison County are looking for a resource in your office, who would you point them to?
I would have them call my office, actually. We're hearing a number of things from our congressional people and also from state people, but initially I think we can kind of help direct those calls if they come to the county chairman's office, and that phone number is 618-296-4311.
Mr. Chairman, thank you very much for being here and sharing that update with our members and giving out that information. We appreciate everything that you're doing over in Madison County. And now I would like to turn it over to Tom Chulik to wrap up.
Thank you, Austin, and thank you everyone for joining us on today's COVID-19 briefing with the regional leadership. While our entire region faces turbulent times, it's great to see the continued collaboration between our region's governments and elected officials. All of these officials are on a regular regional unified conference call several times a week, and it's so gratifying and encouraging to see that level of collaboration, because our region's recovery will depend on our ability to collaborate on innovative solutions to sustain our businesses. Strong leadership from our governments and our civic organizations will be required to guide the region forward during this crisis. So please join us for another Business Resilience Series with Steve Leitholt, CEO of STL Communications, and Sheila Burkhart, CEO of Spry Digital, this Thursday, April 2nd on Zoom. Steve and Sheila will share their ideas on how to navigate technology while working from home, along with tips on managing a remote workforce using some common tools. If you need additional resources, please go to the stlregionalchamber.com COVID-19 resource page. It's being refreshed regularly. It's a great source of information for people throughout the community and all of our constituents. Please email Riley Nix if you'd like more details. You have his email on the meeting notice, but it's rnix@stlregionalchamber.com. We'll get through all this. We'll get through this together, and together we'll win. So thank you everyone for joining our virtual meeting today. The meeting today is adjourned. Thank you for your time.